The state Senate in California just voted 23-14 on Thursday to pass SB 562, which is single-payer Medicare for all. So this is huge, and it's really exciting. National Nurses United worked very hard to get this accomplished. And by the way, I'd like to thank them because they worked with us, Justice Democrats, and Brand New Congress on our petition to get more Democratic congressmen on board with Medicare for all. And so far, it's been an incredible success. The bill started with 72 co-sponsors. It's proposed by John Conyers, Medicare for all bill in the House of Representatives. And we got it all the way up to at least 111. I think it's more as of right now. And that's all because of the hard work you guys did. By the way, if you haven't signed that petition, I don't know what the fuck you're waiting for. Because it works. This works. I'm just told you the results. 72 Congress people, all the way up to at least 111. So your pressure fucking works. They're moving because of you. So go to justicedemocrats.com/single-payer. Sign that petition. And by the way, call your congressperson. If they are in favor of Medicare for all already, thank them. Positive reinforcement's good. Hey, I want to thank you for being in favor of Medicare for all. That's one of the ones we view as a non-negotiable. And you're on board with it, so we got your back because you got our back. Or if they're not in favor of it, say, okay, we're just going to vote you out. Be polite about it, but just say, hey, look, I'm calling to let you know I'm going to vote you out. Myself, and I'm going to talk to everybody I know, we're going to go vote against you because you're a disgrace. You don't support Medicare for all. That's a no-brainer. What's wrong with you? Because of the pressure you put on, we've got way more Democratic congresspeople to be in favor of Medicare for all. And National Nurses United and Brand New Congress worked along with us, Justice Democrats, to do that. But they've also been working very, very hard in California on this bill to get this passed, and they succeeded in getting it through the Senate. So it still has to be approved by the California State Assembly. So we're nowhere near done yet here. Still a lot of work to be done. And eventually, Governor Jerry Brown would have to sign it. And some of the finer points of the bill have yet to be negotiated. But still, this is a big step. And we're at the point now where New York and California are racing to be the first to set up a single-payer system. Here's my only concern, is that if it were to get through, I'm afraid the same thing will happen as happened in Vermont. Now, in Vermont, they already passed a single-payer bill. I think it was Vermont. I could be wrong, though. I know it was a northeastern state, a smaller state. They passed a single-payer bill, but then when they tried to set it up, the health insurance companies, Big Pharma, all turned around and said, oh, well, we're just going to price gouge you if you do that. And so you can't do it. And so they had to back out of it. There was pressure put on them behind the scenes to basically force them not to do it even though it passed. So now the difference is New York and California, huge states, economic powerhouse states, and if they can get it done, New York and California have the sway to fight back against big moneyed interests. A smaller state like Vermont doesn't as much. So if New York or California can pass it and then throw around their weight and get it successfully done, well, then we're talking domino effect. Just like how we saw with gay marriage. Okay, it passed in this state, passed in that state, passed in that state. You go through, and then eventually, whoop, look at that. Supreme Court at a national level said it's unconstitutional to not have gay marriage. You have equal protection under the law. They're supposed to have that. We could see a similar thing with single payer. It could go state by state by state, and then eventually somehow at the federal level, either by getting a wave of Justice Democrats elected or somehow goes to the Supreme Court, whatever, you could eventually see the same kind of thing unfold with single payer. But there's more money lined up against single payer than there ever was lined up against gay marriage. That's the other portion of this. The anti-gay lobby is the Christian fundamentalists. They used to be a lot more powerful in the 70s and the 80s. They aren't as powerful now. And now there are some moneyed interests who are on the side of gay rights. So eventually the ideology, the progressive ideology won out on that one, but also the money won out on that one. We need a really unified approach to stand up and fight back against big pharma and for-profit price gouging health insurance companies in order to get this done. But New York and California are on the way, and that's very, very exciting. I can't wait to see where this goes from here.